keeping them together just winds the whole nervous system, right? So that's, do the best you can for that. And the hands here are helpful in a couple of ways, right? You can tell the person to not like sit back into their hands. That kind of helps, keeps the pelvis perpendicular to the table. So when you ask them to slump, you know, so head up, keep your head up, like look at, you know, Jonathan, or look at that, whatever the silly thing, electro thing I never use. It's kind of same thing. Slouch down as far as you can. So try to really slouch down as far as you can, right? So just do that only and keep the head up, right? And then I always come over to the side that's the involved side, so you can help them get out of it. Then drop your head down as far as you can. And then really get your arm, the crook of your arm on like the thoracic area, so you could really bow the spine, you know, down towards their pelvis, right? And then don't hold the head down, but just be over it, and then just gently straighten out your left leg. And that should pull some behind the knee, which is normal. And stay there and tell me how much I have to take your head up. Goes away. Okay, down you go. And then straighten out this side here. Is that any different? And so on and so forth. And take the head off just a little bit. Okay. Now, if you suspect it to be a pretty disky person and they're still a bit irritable, then you would not flex them, because, you know, sitting flexion is always going to be so bad. So that you would just keep them straight up, and then bed the head down. The sequence would be a little bit different, and then straighten the knee out, right? So you wouldn't have to do that. That would be a way to kind of keep that a little safer to do that test, right?
So
If
you just see just a huge asymmetry between how much they're able to extend their knee,
yeah, that's it.
you don't have to go through the whole like
No.
head thing and stuff.
No.
Okay.
I mean, no, because it's just a huge, yeah. So I have a guy that has like a chronic adherent nerve root. I mean, those are hard. I mean, he just got over the problem on his own. He didn't want to call me, and like, you know, 6 months later, he comes and sees me. Gee, you know, it just it's getting better and stuff like that. But it was a lot of pain science I had to go through with him. You know, he's an engineer too. I think that he would, but he has all these, you know, his head. He's like this, you know, bends forward. That's right. So he's like my age, right? So obviously he needs to kind of work in that direction to really kind of, you know, I've given him so much stuff, but it's getting better, right? Thank goodness he didn't do a bunch of stuff at first, have it incriminated via MRI and all that stuff. He'd be better off. So okay, so we did that. Okay, so if you have to push the test further, then you could obviously. So is this bothering you?
No.
Okay, so she's here. She's here. Then you have to kind of leave a little bit of this alone. You have to kind of hold it a little bit some, and then add dorsiflexion. And then if you have someone give you a hand, add internal rotation and a deduction. That kind of winds it really strong, right? And if none of that bothers them, you know, then you can have them do the long sit slump.
Just does that.
No, so
Oh, so.
I've never seen it.
Just on that
I wouldn't
one.
even allow them to lift it.
hands behind your back here. So, you know, David would say this is one for like the thoracic spine too. So you have them slumped down, right? So you could come over here and really kind of hold their head down, and he would say, you know, you side flex. And they do all this fancy stuff in the sensitive nervous system book, you know, but this would be something you'd really kind of get after. Obviously, somebody that has heaps of range. Lots of there, yeah. So, okay.
Sweet.
You could, I could.
Yeah, we're not gonna back stuff.
Yeah.
I'm gonna die.
That's right. And then on your side, in sideline. So I'm not a big, not a fan of it though, but I probably won't going to ask you to do pibbums of the back. Right, pibbums of the back are kind of hard. But remember, we did do those ones where you know, you're here and you're here and you have the legs in your pelvis. And just letting them rest there and supporting underneath there, and you can do, you know, you can do flexion, right? You can do side flexion, right? You can do extension. Those are the main things, right? You can do some extension with shearing through the to see if there's some instability, but I don't do that a lot. What can we do about that? Can't stay. I mean, we can just give them exercises. So you can do shearing in the do the flexion as well, you have as well to see if there's any. Those are kind of like the test for the knee, right? You know, it's good to know those stuff, but I mean, what are we gonna do? Fix the ligaments, right? Let's get them stronger. That's what they gotta do. Isn't the Washington State done some study about, about